Hi, my name is Dr. David Conversing. I'd like to share with you some of the most effective ways that we use to help people that have been in auto accidents with things such as back and neck pain. There are three main treatments that we use, such as the chiropractic adjustment, electrical muscle stim, and also traction to help you out with those things. Let me talk a little bit about the chiropractic adjustment. The chiropractic adjustment can help you out in three different factors. The first one is to help you with the joints in those areas. The second one is to help you with the discs in those areas, and the last one is going to be helping with the nerves in those areas. Now, as far as helping with the joints, in each area of your back or neck, there's joints as far as the bones above and below, and those joints are called facets, and sometimes if those facets are jammed, they can put a lot of pressure and give you pain. Now, the next step would be the disc in those areas. Now, if we're using the chiropractic adjustment, if we are adjusting those areas, it's going to increase the area or the amount of space that those discs have, which is also going to decrease the amount of pain that you have in those areas as well. And lastly, we have the nerves that we're going to be trying to help out with in those areas. And again, if we have more room and space for those nerves to function, and there's not any pressure applied on those nerves, we're going to have less pain in those areas as well. The next thing I'd like to talk to you about is the muscle stim. So what we do with the electrical muscle stim is we basically apply a couple pads to that area of the back or muscles that are not or that are tight and causing you the pain and discomfort. And what that does is a couple of things. One is it helps reduce the amount of inflammation in those areas, so it's going to help you heal a lot faster. Secondly, it's going to help reduce the amount of muscle spasm or help relax those muscles in those areas. And lastly, it's going to also provide some pain relief, so again, it's going to make you feel better as soon as possible. And lastly, I'd like to talk to you about the traction that we'd use in our office. And the main reason we'd use traction in our office is a lot of times we see people that are cases like yours where they have disc herniations or disc bulges in those areas, and that traction would really help sort of space those bones or provide a little bit of extra space between those joints, so that again we are reducing the amount of pain and also improving things in that way. Now, there's a couple things that we see as far as problems that we treat regarding that. A lot of times people are going to be experiencing a lot of pain when they come into our office, and they're going to have those type of symptoms. The next thing that they're going to be experiencing is they're going to have muscle tightness and also a lot of muscle spasm. And then the last thing we typically see is we see a decrease in range of motion, mostly because of those muscles being so tight. Now, a lot of times people, as far as coming into the office, they're concerned about a lot of the things that they're doing throughout the day. One of the most important things that people have interruption of is their sleep. Not being able to sleep as long, not being able to fall asleep. A lot of those are big issues, especially when you need sleep to recover. The second thing that a lot of people are concerned about is their work. A lot of times if they're injured at work, they're not able to perform as much as they're supposed to, or to perform at the same level if they want to, as far as being able to maintain what they need to do at work. And the last thing is what we call activities of daily living. And what I mean by that is basically personal hygiene, being able to take a shower, things like that, and also being able to just